when the uterus becomes a graveyard. Yes, this video is all about a very rare cause of secondary infertility, and that is retained fetal bones. This condition is not seen very commonly, but it is one condition which is sometimes missed. In this video, I will show you what retained fetal bones or endometrial osseous metaplasia looks like on ultrasound. I will show you what it looks like on hysteroscopy. I will also show you the procedure of removal of these fetal bones and tell you some tips and tricks which I have learned over the years. And in the end, I will show you the histopathology of the tissue that we found. So let's go on this interesting journey when the uterus becomes a graveyard. So this patient had a second trimester miscarriage with us. She had an open os at 16 weeks and unfortunately lost the baby. She would go to her local doctor after the miscarriage with heavy bleeding. Every time, everybody would see the uterus and say that everything is normal. But see what we found. In your scan, always start your scans from the cervix. And here, do you see this linear shadow with dense posterior acoustic shadowing? This is nothing but fetal bones, and so we decided to do a hysteroscopy for her. The moment we enter, just at the internal os, see this bit of lamellar bone. This is nothing but the retained fetal bone, and this was causing ulceration in the endometrium and severe bleeding to her. In this situation, what we do is first visualize it properly, then we insert a grasper, open the jaws of the grasper, and as we are pulling out, just one tip from my side, stop the inflow. When you stop the inflow, you can see this entire bone is nicely coming out through the internal os and it will be taken out. So there it is. There you go. This is the piece of bone. Now we are going for the second piece of bone. The common bones that we find are flat lamellar bones. Sometimes we do find ribs, and we are removing the second bit of bone. Sometimes some part of this bone may be densely adherent or be inside the cavity. This is one such situation where part of the bone is inside the myometrium. So first we try and insinuate and remove it from the myometrium, then grasp it properly and then pull it out. As we are pulling it out, make sure to remove the inflow. And so this another second bit unfortunately is left behind in the cervical canal. I'll go for it again. Open the jaws, try to grasp it at the widest part and bring it out. Sometimes if the bone is very flat, it is little tricky, but here you can see this is the main part of the bone that was, and this is the post-operative ultrasound. So you see the cavity is nicely distending. There are no bony tissues anymore. There is some fluid in the POD, that is nothing but the fluid that leaks out of the tubes on hysteroscopy. And look at these bits of bone that we have removed. These are the three big bits of bones that we have removed. This is probably the pelvic bone, this is a flat bone, and this was the endometrial biopsy which showed bony tissue in the endometrium, ossified tissue. So sometimes it is retained fetal bones, sometimes it is a condition called as endometrial osseous metaplasia, where the endometrium itself differentiates into a bone. The bone is from the maternal tissue which has undergone metaplasia and not from the fetal bone. The differential diagnosis of calcification in the uterine cavity is, of course, tuberculosis of the uterus. It is sometimes a calcified submucous fibroid, but most often, if you see a linear, dense, hyperechoic shadow, always think of retained fetal bones and do a proper hysteroscopy for her. And this patient is very likely to conceive again naturally. Thank you so much.